cover the official ICD-10 guidelines specific to this chapter. There will also be clinical scenarios to practice coding what you just learned, followed by a small quiz at the end of the presentation. For each coding example and quiz, you will need to pause the webinar and use your ICD-10-CM coding manual to code the scenario. Once you resume the webinar, we will go over the correct codes, the rationale behind them, as well as how to locate them in the ICD-10 manual. Keep in mind that there may be more than one way to find a code. We are aware that there is a great deal of information contained in this presentation. Therefore, at any time during the webinar, please feel free to pause and replay as needed. It is important that you have already completed the Introduction to ICD-10 webinar, as you will use the conventions and general guidelines discussed in the introduction to complete the coding scenarios. As you can see on this slide, the codes for this chapter start with the letter E, which is kind of easy to remember, E for endocrine. If you remember from ICD-9, these codes all started with the number 2, however there are many more codes for the endocrine system in ICD-10, primarily due to all the new combination codes for diabetes, which we'll review in more detail. The most commonly used diagnoses in this chapter are the diabetes diagnoses. There are 3 main types of diabetes: type 1, which means the patient is insulin dependent, type 2, and gestational, which is diabetes that occurs only in pregnancy. There are many more diabetes codes in ICD-10 compared with ICD-9 due to the fact that we now have combination codes, which combine the type of diabetes, such as type 1 or type 2, with associated complications, such as type 2 diabetes with peripheral vascular disease. There are also codes for secondary diabetes, meaning diabetes caused by a disease such as cancer or diabetes due to drugs. If the documentation does not include the type of diabetes, the default for coding is type 2 diabetes. Do you remember in ICD-9 that there are codes for controlled and uncontrolled diabetes? This concept no longer exists in ICD-10. Instead, you would code based on type of diabetes documented and any complications present. I want you to try an example. Documentation states that the patient has type 2 diabetes with hyperglycemia. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The answer is E11.65, type 2 diabetes mellitus with hyperglycemia. This code can be found by going to diabetes in the alphabetic index, then finding the phrase type 2. You would then find the word with indented below type 2, and there's a term for hyperglycemia, which points me to E11.65, which I then confirmed in the tabular. Let's do another diabetes example. A 45-year-old man with type 1 diabetes is seen in his physician's office with very low blood sugar. The physician diagnosed him with hypoglycemia. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The answer is E10.649, type 1 diabetes mellitus with hypoglycemia without coma. This code was found by going to diabetes in the alphabetic index, finding the phrase type 1, and then looking underneath the word with, which is indented below type 1, and then there's the term hypoglycemia, which points me to E10.649, which I then confirmed in the tabular. We know when we confirm the code in the tabular that since documentation does not state that the patient had a coma, the default is without coma. Even if the documentation states that the patient uses insulin, but type of diabetes is not documented, you cannot assume that the patient has insulin-dependent or type 1 diabetes. As we discussed on a previous slide, if the type of diabetes is not documented, your default is type 2, which is category E11. If documentation indicates that the type 2 patient uses insulin, Z79.4 for long-term use of insulin should be coded in addition to your diabetes code. However, you would not code Z79.4 if insulin is temporarily given to a type 2 patient who doesn't normally take insulin. This code is for long-term use of insulin. One of the new concepts of ICD-10 is underdosing, or taking less of a medication than is prescribed. If the patient experiences insulin pump failure, your first code will come from subcategory T85.6 for mechanical complications. ICD-10 specifies the type of complications, such as breakdown of insulin pump, displacement, or leakage. An important rule to remember is that if the encounter is for treatment of a complication, the complication code goes first. Your next code would be T38.3X6 for underdosing of insulin, with the appropriate 7th character added for episode of care. If you remember from the introduction to ICD-10-CM, those episodes of care were initial, subsequent, and sequela. You would then have additional codes for type of diabetes and any associated complications due to the underdosing. If the patient experiences an overdose of insulin due to pump failure, your first code will still be from category T85.6 for mechanical complications, such as breakdown of insulin pump. Your next code would be T38.3X1 for accidental insulin poisoning, with the appropriate 7th character added for episode of care. You would then have additional codes for type of diabetes and any associated complications due to the overdose. Let's try an insulin complication example. The patient with type 1 diabetes is seen in the emergency department with very low insulin. The patient is on an insulin pump. The pump was tested and the physician determined that the pump was not working properly, causing too much insulin to be administered, which would be an overdose of insulin. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. Our first code is T85.614A, breakdown mechanical of insulin pump, initial encounter. Remember that since the patient was seen for a complication, the complication code goes first. You would locate this code by going to the term complications in the alphabetic index, then locate insulin pump. Indented under insulin pump is the term breakdown, which points to code T85.614. The checkbox tells us we need a 7th character. When we confirm the code in the tabular index, we see that our choices are A, D, and S for our 7th character. Since the patient is being newly diagnosed with the pump complication, a 7th character of A is appropriate for initial encounter. The next code is T38.3X1A, poisoning by insulin and oral hypoglycemic antidiabetic drugs, accidental, unintentional, initial encounter. To find this code, go to the table of drugs and chemicals and then locate insulin. Since we know from the previous slide that an insulin overdose is considered an accidental poisoning, we would use the code in the accidental poisoning column, which is T38.3X1. When we confirm this code in the tabular, we see that a 7th character is required and A would again be used. Our final code is E10.649, type 1 diabetes with hypoglycemia without coma. This code was found by going to diabetes in the alphabetic index and then finding the phrase type 1. From here, we look underneath to the word with, which is indented below type 1, until we find the term hypoglycemia. This points to E10.649, which you would then confirm in the tabular. We know when we confirm the code in the tabular that since documentation does not state that the patient had a coma, that the default is without coma. For patients who have secondary diabetes, make sure you follow the tabular list instructions for proper sequencing of the secondary diabetes codes and their causes. Category E08 is diabetes due to underlying condition. You would code the underlying condition first, such as cystic fibrosis or cancer, followed by the E08 category code. Category E09 is drug or chemical-induced diabetes. If the patient was taking the prescribed amount of a medication and still developed diabetes as a result, which is known as an adverse effect, you would code the E09 category code first, followed by the adverse effect code. And you would locate the adverse effect code by going to the table of drugs and chemicals. Let's try a secondary diabetes example. We have a 23-year-old male with secondary diabetes due to acute idiopathic pancreatitis. He has diabetic hyperglycemia and takes insulin. How would you code this? Please pause the webinar to complete this example and then hit play to continue and learn the answer. The first code is K85.0, acute idiopathic pancreatitis. Remember that for secondary diabetes due to an underlying condition, that the underlying condition is coded first. To locate this code, go to pancreatitis in the alphabetic index, and the next heading is acute. Indented below acute is the term idiopathic, which points to K85.0, which you would then confirm in the tabular. The second code is E08.65, diabetes mellitus due to underlying condition with hyperglycemia. To locate this code, you would start with diabetes in the alphabetic index and then look for due to underlying condition. Once you're there, indented below is the term with, and under the term with, you would look for hyperglycemia, which points to E08.65, which you would then confirm in the tabular. If you had coded this first, the instructional notes in the tabular would remind you that the underlying condition must be sequenced first. The final code is Z79.4 for long-term current use of insulin. This can be found by going to long-term drug therapy in the alphabetic index, looking for insulin indented below, which points to Z79.4, which you would then confirm in the tabular. Now it's time for our quiz. Our first question is, true or false? Diabetes mellitus codes and complications are combination codes. Our second question is, true or false? Controlled versus uncontrolled diabetes mellitus is coded in ICD-10-CM. Our final question is, if the type of diabetes mellitus is not documented in the medical record, the default is blank. You can pause the webinar to write down your answers and then hit play to find out if you were correct. The answer to our first question is true. Diabetes and resulting complications are combo codes in ICD-10. The answer to the second question is false. Controlled versus uncontrolled diabetes is not present in ICD-10. Instead, we code for the type of diabetes and resulting complications. Our third answer is type 2 diabetes. Remember, the United States will be using ICD-10 on October 1st of 2015. After the October 1st compliance date, it will be very important to verify that claims are being received and to check remits for denials based on the ICD-10 conversion. This concludes Chapter 4 of ICD-10-CM, Endocrine, Nutritional, and Metabolic Diseases. Please feel free to check out our webinars on all 21 chapters on ICD-10-CM. If you need further assistance with ICD-10 training for your physicians and/or staff, please visit the VantagePoint website at www.vantagepointconsult.com or call us at 203-288-6860.